Hello people, in this video we want to look at iodine. Iodine basically under community medicine we want to look at. What is iodine, guys? See, iodine comes under minerals. It is actually a trace element. We just need it in small quantity. Where is it? Here, iodine, okay? So these are required by our body in less quantities of less than few milligrams per day. So you can remember as microgram for iodine, okay? So coming to iodine, where is it in the periodic table? You know, it is a halogen. It's coming here, right? Do you know its atomic number? It's 53. Okay, iodine. So basically it is what? It is an essential micronutrient. It is required for what? For synthesis of thyroid hormone. So you can see here it is required for thyroid hormone, and thyroid hormone are what? T3 and T4, right? And what will these help in? They will help in growth. Right? What will thyroid hormone help in? Growth. So guys, do you know that our body already has 50 milligram of iodine? We already have 50 milligram of iodine. Okay. And in the blood, the level is about 8 to 12 microgram. In blood, what it is? It is microgram. And that is per deciliter. I'll just leave that. Okay. Just learn 50 milligram of iodine our body already has. Milligram it has. Okay. But our daily requirement is only microgram, that you remember. It is a micronutrient. You need only microgram. Daily recommended allowance for you, adult, let us say 150 microgram per day. Please don't remember everything. You'll just get confused. Remember this one. Iodine 150 microgram per day you need. Okay. Adult male female requires 150 microgram per day. How much it is there in our body? Milligrams is already there in our body. You have to take microgram per day, 150. Okay. So what is the requirement? It is 150 microgram. During pregnancy, it is little more. Okay. So it is supplied by well-balanced diet and drinking water. Okay. Drinking water. Interesting. Even drinking water has. Yeah. Drinking water. Okay. Salt. So salt will be dissolved in water, is it? So now that you know how much you want per day, how will you get it? You know how to get iodine? Just eat seafood. Okay, but if you don't eat seafood, then you can go for milk, vegetables, etc. as usual. Then, see, 90% of iodine comes from food and the remainder comes from drinking water. From drinking water, you can get iodine. Okay. So iodine content of salt determines presence in water. Obviously makes sense. If it is there in salt, it would have entered the water. Yes. And these are the natural sources. What are they telling you? Iodine is there in seafood, milk, vegetables, etc. And then you remember drinking water. Okay. Don't forget the water. Okay, drinking water, and based on the amount of iodine in soil, water will have water will have iodine. Okay. So now remember, because of government rules, salt that is sold has to be iodized. Iodized salt only you have to eat in India. See, iodine deficiency will cause goiter. So just remember what goitrogen is. Goitrogens are chemical substances leading to the development of goiter. Goiter is enlargement of thyroid, right? Thyroid gland. So goitrogens are bad things, right? They lead to the development of goiter. They interfere with iodine utilization by the thyroid gland. They may occur in food and water. So the vegetables like cabbage, cauliflower, all these are bad. So gobi manchuri is bad. So they contain goitrogens. The most important dietary goitrogen are probably cyanoglycosides and thiocyanate. To be specific about the chemicals, they are glycosides and thiocyanates. So people, you looked at something called as goitrogens, which lead to iodine deficiency. These goitrogens can be present in the water and food. These will lead to what? Iodine deficiency. They interfere with iodine utilization. Where can they be? They can occur in food and water. How sad. Whatever you eat, drink, in that itself, you can have goitrogens like cabbage, cauliflower. Mainly, what are the chemicals? Cyanoglycosides, thiocyanate, cyano is there. So you can remember cyanates, all these. Okay. So did you understand, guys? So let us see what will happen if there is iodine deficiency. So iodine deficiency disorders in approximate order of increasing severity. So first, iodine is not the first thing that happens is goiter. So your thyroid gland enlarges. You have grade 1, grade 2, grade 3, some multinodular. Let's look at this. Hypothyroidism. So the thyroid hormone levels decreases. So what will happen? Growth will not happen. Depending on the age, the severity will be there. So in young age, if it is there, what will happen? You will have cretinism, right? So then we will see subnormal intelligence, delayed motor milestone, mental deficiency, hearing defects, speech defects. So basically development, nothing is happening properly. Mental deficiency can be the hearing defects, obviously speech defects if there's hearing defect. Motor milestones they will miss because growth is not happening. Intelligence will be less, yes. Then coming to strabismus, squint can be there. Then nystagmus, okay. So eye issues can be there, guys, because of iodine deficiency. So muscles or nerves because of what? This is, they're saying it is squint, but they didn't say which cause it is anyways. Guys, what are we looking at? What iodine deficiency leads to. What did we see till now? We saw that mainly it affects the thyroid levels. It causes goiter, decreases thyroid level. So hypothyroidism, this will affect mental development, language development, motor development, etc. Eyes, it is affecting squint, nystagmus, then spasticity. So muscle weakness will be there, neuromuscular weakness, muscle weakness, then spastic diplegia, spastic quadriplegia, all 4 limbs is it. So this is what happens if there is iodine deficiency. Endemic cretinism, hypothyroid cretinism, neurological cretinism. Cretinism is what? Hypothyroidism in young people. That is cretinism. Last thing they are mentioning, because it is of low severity, they are talking about intrauterine death, spontaneous abortion, miscarriage. Okay, so the baby can die inside, the fetus can die inside. There could be spontaneous abortion, miscarriage. Okay, because of iodine deficiency. And in case the baby is born, what will happen? There can be cretinism, right? And this is what is goiter, enlargement of the thyroid gland, right? So there are so many grades in this. Grade 1, grade 2, grade 3, multinodular. Okay. So the deficiency of iodine is geochemical in nature. Why? Because it is in soil, etc. And if it is not there, then probably it will be less in the people. See, what is mixed edematous cretinism? See, what is mixed edema, first of all? Mixed edema, I think mixed edema, they are referring to hypothyroidism in adults, right? So they are kind of saying what will be there in that. Guys, mixed edema is swelling of skin, underlying tissues, etc., waxy consistency. All this probably because of hypothyroidism, okay? So here they are saying mixed edematous cretinism. They are including both. So dwarfism with severe mental retardation, they are saying. Okay. So as goiter is not the only problem because of iodine deficiency, now instead of endemic goiter word, they are using iodine deficiency disorders. What are they using? The word instead of goiter, what did I say? Instead of endemic goiter, they are making it as IDD. IDD is what, guys? Iodine deficiency disorder. Remember IDD. Wherever you see IDD, you know, in national programs, wherever you see IDD, it is iodine deficiency disorders. Okay. Let's look at some epidemiology, guys. So basically in India, they have some belt, that is Himalaya Goiter belt, which is the world's biggest Goiter belt. It stretches from Kashmir to Naga Hills in the east, extending for about 2,400 kilometers and affecting the northern states of Jammu Kashmir, Himachal Pradesh, Punjab, Haryana, Delhi, Uttar Pradesh, Bihar, West Bengal, Sikkim, Assam, Arunachal Pradesh, Nagaland, Mizoram, Meghalaya, Tripura, Manipur. So that is the Himalayan Goiter belt. So if they ask you in exam, Himalayan Goiter belt, name all the states that come here. Okay, what they have highlighted here. Let's look at this again. See here, goiter endemic areas. So here and there some states, inside some states, but these states looks like they're completely shaded, right? So that is the Himalaya Goiter belt. Okay. How do you know these people? There is iodine deficiency here. What are the indicators? Surveillance. What will you check? You'll check prevalence of goiter. You'll check prevalence of cretinism. Urine iodine excretion. You will see how much the iodine is being excreted in the urine. Then measurement of thyroid function, you will do thyroid function tests, right? And you will check level of T4, you will check level of T3, TSH, thyroid stimulating hormone, right? All this you will check. T4, TSH mainly they are checking. Then you will also check for the prevalence of neonatal hypothyroidism. If there is neonatal hypothyroidism, something that will lead to cretinism, right? So all this you will check. These will be your indicators. These will be your indicators, remember. Okay. Remember, T4 will give you more sensitive indicator than T3. Okay. So now you understood what the indicators are for iodine deficiency. Very good. Now let's move on. See, under goiter control, you have so many things. You have iodized salt, iodized oil, called iodine monitoring, which we already saw, manpower training, mass communication, and hazards of iodization. Iodine can become a poison also. That is iodism, right? Anyways, we'll come to that. Basically, iodized salt. Under the Prevention of Food Adulteration Act, you should have iodine in salt not less than 30 parts per million at the production point and not less than 15 parts per million at the consumer level. Okay. National Institute of Nutrition at Hyderabad, now they have come up with iodine and iron in salt. They are trying it, looks like 2-in-1 salt they are calling it as, where you'll have iron and iodine in salt. Okay. Then actually, guys, do you remember in the lymphatic filariasis, we studied that in Lakshadweep, they have so much filariasis. Obviously, it's coastal, right? So, Lakshadweep, in the salt, they will add diethyl carbamazine, right? So that they can control lymphatic filariasis. See, diethyl carbamazine, medicated salt for community-based control of lymphatic filariasis. If I'm not wrong, this is in Lakshadweep, right? Remember in our Vuchereria Bancrofty video, we have seen that. But anyways, that's a diversion. Anyways, that was just a diversion to tell you that now what iron and iodine, they have so many medicines also in salt. Okay. But only in, as of now, only in Lakshadweep, they're talking about that. Iodized oil is there, guys. But how they are giving this? No, as intramuscular injection, they're giving oil. Interesting, right? Mostly poppy seed oil, and even orally you can take this oil, it seems. That's interesting. They're going to give intramuscular injection of oil, iodized oil. Iodine monitoring, we already told you. If you already forgot what monitoring is, go back to the previous slide and see. It's prevalence of goiter, prevalence of cretinism, urinary iodine excretion, check thyroid function, check for thyroxine and TSH levels, check for prevalence of neonatal hypothyroidism. These are your iodine monitoring. Then you have manpower training. So train manpower, mass communication. You tell people to use iodized salt, right? All that you will do, right? Health education, basic things you will write in the exam. Hazards of iodization means what? See, it is called as iodism, okay, iodine poisoning. It's a non-metallic poison and it will cause some skin problems and parotid enlargement, and it can cause thyrotoxicosis. Thyrotoxicosis means what? More thyroid hormone, right? But this iodine, remember, it has some dual effect. If you give iodine, then there will be there was some Wolff-Chaikow effect also, remember, where so you give large dose of iodide or iodine, it will decrease the thyroid hormone levels, okay, some Wolff-Chaikow effect. But then thyroid escape can happen after 2 to 8 weeks, okay, and that may return the thyrotoxicosis with greater vengeance. So this is a crazy thing with iodine, okay. So hazards of iodization, iodism, thyrotoxicosis can happen, okay. Then coming to iodine Deficiency Disorders Program. So this is what we were talking about, right? See, earlier it was National Goiter Control Program earlier. So we'll make it gray. Earlier it was this. Now what they have? The IDD Control Program. National Program for National IDD Control Program. So NIDDCP. NIDDCP. Whenever you will see IDD, you will not get confused. Okay. NIDDCP. NIDDCP. National IDD Control Program. Very good. Look at the sun and smiley. What is it written here? Iodine namak. Namak is salt, right? Something like Shakti or Buddhi ka Rakshak. Nice, right? So let's continue, guys. What are we looking at? National IDD Control Program. What are the objectives of National IDD Control Program? This one. Not this. Objectives of National IDD Control Program, guys, to surveys to access the magnitude of iodine deficiency you want to know. So this is a red thing. You want to know the magnitude of the problem. Okay, then iodine deficiency disorder, IDD, in districts you want to know. Supply iodized salt. Okay, we will supply some iodized salt. Then reassess, is it? Yes, it is resurvey. You'll do resurveys to assess the iodine deficiency disorders and the impact of iodized salt. Every 5 years you will go and check, was there any improvement? So you will go and check the impact of iodized salt after every 5 years. So you will do resurvey. Okay. Lab monitoring of iodized salt and urinary iodine excretion. This is monitoring. We already told you how to do monitoring, right? Check TSH, T4 levels, iodized salt you monitor, uterine iodine excretion you will check, health education and publicity. So you will write these objectives of National Iodine Deficiency Disorder Control Program. And then what are the achievements of these people? Okay. What are their achievements? Did they achieve anything? Yes, people. They made lakhs of tons of iodized salt, and they stopped the sale of non-iodized salt. So the salt commissioner sounds like some independence kind of thing, right? The salt commissioner has issued licenses to so many salt manufacturers. They have commenced production. So they are producing annual capacity of so many lakh metric tons of iodized salt. So under this Food Safety and Standards Act and Regulation. So all this NIDDCP control program has been implemented in so many states, right? And how will you monitor for the elimination of these iodine deficiency disorders? You will check for goiter. Urinary excretion of iodine, very important. They're mentioning that so many times, especially in pregnant women, you can check this. If they have hypothyroidism, then the fetus will go into hypothyroidism, cretinism, etc. So it is very important to check this, and you can check neonates with hypothyroidism. Also check how iodized salt is being used in households. So in this video, we wanted to look at iodine as a community medicine perspective. So we are taking a recap now. So basically, iodine is a trace element required for us. It is a halogen, you know that, and basically it is a essential micronutrient. It helps in the synthesis of thyroid hormone T4, T3, and remember that this thyroid hormone is important for growth and mental development. So if there's no iodine, there'll be no thyroid hormone, leading to goiter, that is enlargement of the thyroid, and leading to hypothyroidism, where growth retardation can happen, mental retardation also can happen. So our body already contains normally 50 milligram of iodine, and our daily requirement is 150 microgram of iodine per day for men and women. Okay, 150 microgram per day, don't forget. Okay, where this iodine is there even in drinking water. Remember, in soil it is there, in drinking water it is there. The sources, natural sources, are seafood, milk, vegetables, drinking water. Now the government has introduced iodized salt, which can be a source of iodine for you, right? So goitrogens are things that will impair the iodine utilization by the thyroid gland. So these goitrogens are cabbage, cauliflower, etc. These the dietary goitrogens are cyanoglycosides and thiocyanates. Cyano, you can remember. What will iodine deficiency lead to? Goiter mainly, grade 1, grade 2, grade 3, and multinodular goiter. It can lead to hypothyroidism. Based on age, it can have different effect. There can be delayed motor milestones, mental deficiency, subnormal intelligence, hearing defects, speech defects, etc. There can be eyes. You can consider strabismus, squint, nystagmus, spasticity of muscles, very weak, spastic diplegia, spastic quadriplegia. There can be hypothyroid cretinism, neurological cretinism. That is all if the baby is born, but sometimes the baby is not even born. Intrauterine death, stillbirth, abortion, miscarriage, etc. Okay, and did you get it, guys? Let's move on. So basically, as it is not just goiter that it causes a lot of other things. Now, instead of endemic goiter, they are using this terminology, that is, they are not using endemic goiter terminology. They're using it iodine deficiency disorders. IDD is the term because it just doesn't cause goiter. It is not endemic goiter. It is IDD, iodine deficiency disorders. Okay. So what else did we see? We saw that in India we have the Himalayan goiter belt, that is from Jammu Kashmir to the Naga Hills in the east. Everywhere here there is iodine deficiency. how will you assess that these people have iodine deficiency? How did you come to know they have iodine deficiency? You surveyed the prevalence of goiter, the prevalence of cretinism, urinary iodine excretion you checked, then you checked for thyroid function test, you checked for T4 and TSH levels, you checked for neonatal hypothyroidism. So you came to know that this Himalayan goiter belt has iodine deficiency, right? And then how do you do goiter control? You have iodized salt, right? 30 parts per million in manufacturing level, 15 parts per million at consumer level. So now National Institute of Nutrition of Hyderabad, they have come out with 2-in-1 salt which can have iron and iodine that will have 40 microgram. Remember, iodine, everything is microgram except the amount of iodine that is there in our body. So 40 microgram of iodine plus 1 milligram of iron in 1 gram of salt. Guys, are you focusing? This is what we're talking. National Institute of Nutrition of Hyderabad, they have given this 2-in-1 salt. Okay. Then you have iodized oil, which is actually given as intramuscular injection. And you have, this can be taken orally also. Then you have iodine monitoring. We told you how to monitor. As such, you will say manpower training, mass communication. Mass communication, yes, and all health education to use iodized salt, etc. Hazards of iodization also is there in goiter control. See, you should know that excess iodine can lead to iodism, thyrotoxicosis, that Wolff-Chaikoff effect. Okay. Iodine Deficiency Disorders Program. So this is the one that is there currently in our country, NIDDCP. So what do you know about this? It came in 1992. Earlier you had National Goiter Control Program. That was in 1962. Now you have in 1992 you have this IDD control program. This one says Shakti or Buddhi ka Rakshak. What is the Rakshak? Who is protecting you? Iodine namak. That is salt. Okay, iodized salt. Then what are the objectives of this program? Okay, surveys. You will survey to assess the magnitude of iodine deficiency. Then you will supply the iodized salt. You will check the impact of iodized salt every 5 years, and you will monitor all that urinary iodine extraction, excretion, etc. Then health education and publicity, guys. Then let's move on. What are the significant achievements of these people? There was a salt commissioner. He issued the licenses to salt manufacturers to make iodized salt. They have made annually some 200 lakh metric tons of iodized salt. Then they have banned the sale of non-iodized salt. Food Safety and Standards Act and regulations. Right? You have this Food Safety and Standards Act. That's it. Then what if a person has a lot of iodine excess in their body? Then they'll have to take non-iodized salt only, right? See, here there's some non-iodized sea salt. I don't know what they use it for. I think this, if I'm not wrong, sometimes they use it for making the saline sprays or something, nasal sprays. I'm not sure. Anyways, then this NIDDCP, they have implemented this everywhere. All states, looks like almost. So you will monitor for the elimination of this IDDs. Iodine poisoning can lead to iodism. So focus, guys. Iodine, if it is more also, it is bad. So it is a non-metallic poison that can lead to skin patches, ioderma, some parotid enlargement, etc. So in radiology, you use iodine. Remember, just this is nothing to do with community medicine. Radiology, you use radioactive iodine. Remember, for all the scans, etc. It's used as contrast agent also, looks like. Anyway, so we're done with iodine in community medicine. Bye-bye.